Hi, so what I'd like to do today is talk to you about the concept of oxidative stress and the role of antioxidants in male infertility. So I'll review the biological basis for the use of antioxidants in male infertility. I'll talk about the role of dietary antioxidants in male infertility, and I'll also talk about the effect of in vitro oxidative stress and antioxidants on sperm function. So what is the basis for studying antioxidants in male infertility? Well, we know that male infertility is associated with high levels of semen oxidants, reactive oxygen species, and oxidative stress. Years ago, we had shown that a substantial percentage of men, infertile men, have high levels of semen ROS, whereas fertile men do not have these high levels of ROS. And the source of semen ROS is twofold. One, they are sperm-derived, likely related to defects in sperm maturation and spermatogenesis with retention of residual cytoplasm. The other source of ROS is leukocytes, and these are likely post-testicular, probably related to pathology such as prostatitis and epididymitis. Now, when we talk about reactive oxygen species, we're talking about a number of individual species such as superoxide anion, hydrogen peroxide, hydroxyl radical, and nitric oxide. It's important to recognize that each one of these species has a different reactivity, half-life, and potential target sites, with the hydroxyl radical being the most potent of these. Now, we know that reactive oxygen species are ubiquitous in aerobic biologic systems, and they both have physiologic and pathologic functions. Now, pathology stems from an imbalance between production and scavenging or degradation. So if you have a high level of production with insufficient degradation or scavenging, pathology results. We've known for about 20 or more years that high levels of semen ROS will impact on fertility. And then in this study by Aiken, reported over 20 years ago, they have shown that in couples where the man has high levels of semen ROS, we see lower natural pregnancy rates than in couples where the man does not have high levels of semen ROS. So putting some clinical importance to this concept of oxidative stress. Now, we know that the etiology of male factor infertility is multifactorial. There are several potential causes of infertility. And for many of these causes, an oxidative stress component has been identified, including varicocele, idiopathic infertility, infection, cryptorchidism, endocrine factors, lifestyle factors, to name a few. Semen ROS levels are associated with sperm dysfunction and DNA damage. So a number of studies have shown that there is an inverse relationship between the production of semen reactive oxygen species and sperm function such as motility and viability. And we think that it is related to the fact that spermatozoa are very vulnerable to oxidative stress because of their plasma membrane characteristics. Semen ROS levels are associated with DNA damage, which is a new marker of sperm function, and several studies have shown this using different assays of sperm DNA damage. We also have shown that oxidative DNA damage is associated with infertility. Again, another marker of oxidative stress that has been related to infertility. Now, we can replicate a lot of the oxidative injury by doing these experiments in vitro, which again supports the concepts of oxidative injury and infertility. So in these studies done by Aiken, what they've shown is that if you induce injury in vitro, you can replicate some of this injury. In this particular set of experiments, hydrogen peroxide was used to induce loss of motility and DNA damage, and the effect was dose-dependent. Now, spermatozoa have very limited capacity to neutralize semen ROS, and this may be one of the reasons why oxidative stress will cause infertility and will cause sperm dysfunction. And we believe that some men may have semen antioxidant deficiency. So, as I said, spermatozoa have very limited antioxidant capacity, and that has to do with the fact that they have very minimal cytoplasm. They are very compact cells with really just a nucleus and a flagellum, which allows for motility. Now we know that seminal plasma is a rich source of antioxidants, and these antioxidants will help spermatozoa, protect spermatozoa from oxidative stress, and these include enzymatic and non-enzymatic antioxidants. The question is whether a seminal antioxidant capacity deficiency is present in infertile men or not. And some studies support the fact that antioxidant deficiency is identified in some men. Other studies have not shown that. So this is still a controversial subject. Now, is there any evidence of systemic antioxidant deficiency in infertile men? What are the factors that promote antioxidant deficiency? Well, we know that severe malnutrition can do that, whether it's socioeconomic or medical, but this is a rare phenomenon in North America and Europe. We also know that alcohol abuse and cigarette smoking can affect antioxidant levels, and this is a relatively common problem in North America. Special diets are also important to consider. These can affect the antioxidant levels systemically and perhaps even in semen. Now, is there any further evidence of a relationship between semen antioxidant levels and sperm dysfunction? Well, a number of studies that have shown that men that have low levels of semen antioxidants, specifically vitamin C, selenium, will have poorer sperm qualities, poorer sperm motility, higher levels of DNA damage, again supporting the concept that infertile men may have a deficiency in seminal antioxidants. However, we do have some negative studies in this respect. One study looked at fertile volunteers, and in this particular study did not show any relationship between vitamin intake and the level of DNA damage, which was here used as a marker of oxidative stress. So in summary, we can say that systemic antioxidant deficiency is uncommon in North America, perhaps with the exception of vitamin C deficiency, common in smokers, dieting changes, malnutrition, but there are too few studies to really evaluate the relationship between male infertility and systemic antioxidant deficiency. Is there any further evidence of a relationship between semen antioxidant levels and sperm dysfunction? Well, most studies of infertile men show that a low level of semen antioxidant capacity or vitamin levels will be associated with sperm dysfunction. So what I'd like to do now is move on to antioxidant therapy. It's important to know that we don't have studies that feature an ideal dietary antioxidant, but if we did, we would want to have an antioxidant that has a role in reproductive function, one that can replete a deficiency, that's effectively concentrated in the reproductive organ, one that is safe, that enhances testicular and epididymal functions, one that enhances seminal antioxidant capacity, and ultimately improves male fertility potential. When we look at the trials on dietary antioxidant supplements, we have to recognize that most of these trials are small, using variable regimens or combinations, mostly uncontrolled studies with very different patient groups. And we don't have any good mechanistic evidence as to the role of antioxidants in oxidative stress, because a lot of these studies have not evaluated some of the specific markers we'd like to look at. So let's start looking at some of the antioxidants that have shown a role in sperm dysfunction and potential beneficial effect in men who present for infertility. So one of these antioxidants is vitamin C, which is a common antioxidant found in fruits, vegetables. Deficiency of this antioxidant is relatively common in North America, potentially related to insufficient dietary intake or smoking. This antioxidant does have a role in spermatogenesis and works as a semen antioxidant, so probably important in this function. Now, perhaps the most relevant study in this respect was published about 20 or more years ago, showing that if you take healthy volunteers, put them on a dietary vitamin C restricted diet, you will have very low levels of semen vitamin C, and you will have high levels of sperm DNA damage. If you then take these men and increase their dietary supplements with vitamin C, you will increase levels of vitamin C, and you will have lower levels of DNA damage. So suggesting that in men with a low vitamin C diet, raising levels of vitamin C in the diet and in semen will reduce oxidative injury. So perhaps one of the most compelling evidence of the role of oxidative stress and the benefit of vitamins. Now, what other studies do we have on vitamin C? So there are a number of randomized controlled trials that have looked at vitamin C alone or in combination with vitamin E, selenium, and zinc. And most of these studies have shown a beneficial effect on motility, DNA integrity, concentration, and morphology. But it's important to know that these are small studies with a very short duration of treatment. There is one negative study in this respect. Another one of the antioxidant that has been studied is vitamin E. Now this antioxidant is found in vegetable oils, in rich cereals. Deficiency in vitamin E is quite uncommon in North America. And again, this particular vitamin has an important role in germ cell viability and epidermal function, so potentially important in fertility. There have been a number of randomized controlled studies looking at vitamin E specifically, either alone or in combination with other vitamins such as vitamin C, selenium, or zinc. And most of the studies we see here, 6 randomized controlled trials compared to 2 negative ones, most studies have shown a beneficial effect on motility, concentration, sperm DNA integrity. Again, the studies are relatively small with a relatively short duration of therapy, 2 to 6 months. Another important antioxidant is selenium. It is found in nuts, fish, eggs, poultry. Deficiency of this antioxidant is again uncommon in North America, and it is a particularly important antioxidant because it serves not just as an antioxidant but as a component of a structural protein in sperm. There are 3 studies, randomized control studies, looking at selenium. 2 have shown a beneficial effect on motility and concentration. 1 was a negative study. Again, short duration of treatment, small studies. 2 other antioxidants and supplements, zinc and folate, have been used in the treatment of infertility, and these are important components. Again, deficiency of zinc is uncommon in North America, but perhaps folate may be a little more common. There may be a genetic predisposition to a folate deficiency. These 2 components are important for spermatogenesis, steroidogenesis, chromatin stability, and also important in DNA and amino acid synthesis. Several studies have looked at the combination of zinc and folate or zinc alone, and in fact all of the studies looking at these 2 particular antioxidants or supplements have shown a significant beneficial effect. No negative studies using zinc and folate. So zinc and folate clearly appear to be beneficial in this respect, but again, keep in mind that these are small studies with short-term duration. L-carnitine is one of the agents that has been studied more recently. It is found in beef, fish, poultry. Deficiency in L-carnitine is uncommon in North America, and we think that this antioxidant is important as it is important for epididymal antioxidant function. Now there are 4 or 5 studies that have looked at this. I've listed here 4 randomized control studies. 3 of the studies were positive, showing a positive or beneficial effect of L-carnitine with or without L-acetylcarnitine on concentration, motility, and morphology. 1 study was negative. A more recent component has been evaluated, coenzyme Q10. This has been looked at as an energy source and as an antioxidant. We know that there are high concentrations of coenzyme Q10 in the testis, so we believe that there may be a role in spermatogenesis and perhaps as an antioxidant. Deficiency of CoQ10 is uncommon in North America, but it has not been studied extensively in the context of infertility. There are 2 randomized controlled trials of 6-month duration that show a beneficial effect of coenzyme Q10 on concentration, motility, and morphology. No negative studies. So this is a promising agent and has been introduced in many of the clinical scenarios to treat male infertility. Now, what about pregnancy rates? Now, there's been a recent review of the effect of antioxidants on not just sperm parameter outcome, but also on pregnancy rates. And these studies, this particular study, systematic review, has shown that the use of antioxidant supplements in men will improve pregnancy rates in the couple. Again, the studies are relatively small. The use of these antioxidants looks at different combination of antioxidants. We have vitamin E, carnitines, CoQ10, combination antioxidants. And because we have a short duration of treatment, we have an overall relatively low pregnancy outcome in the treatment and in the control group, but nonetheless a significant odds ratio in favor of antioxidant therapy versus placebo. So this particular study does support the use of antioxidant treatment in male infertility, with the caution that we don't know the optimal or best treatment, and we don't have a sense of the best treatment duration. So if we were to summarize the in vivo studies, what we can say is that based on the number of randomized controlled trials we have, there is a positive effect on sperm parameters, there is a beneficial effect on pregnancy rates, and the favored antioxidants include zinc, folic acid, vitamin C, vitamin E, CoQ10, L-carnitine, and selenium. But it's important to remember that these studies are small, that the mechanisms of action are unknown, and the optimal antioxidant combination has not been defined. So keep in mind that these supplements may be beneficial, but we still don't know the exact combination that we should use, and the mechanism of action has not been defined. Now, what I'd like to move on to is the role of antioxidants in protecting sperm in vitro from oxidative damage due to exogenous ROS, due to endogenous ROS, and due to freeze-thawing procedures. This is to support some of the data that we see clinically with the use of in vivo oxidants. So as I said earlier, reactive oxygen species are derived from two sources, spermatozoa and leukocytes. So if we look at the first scenario, we can see that with leukocytes, you can get generation of reactive oxygen species in the medium. This will have a potential effect on both abnormal sperm, showing cytoplasm retention, and normal sperm. So reactive oxygen species from leukocytes is detrimental to all sperm populations in the semen. However, in the setting of sperm-derived ROS, the spermatozoa with the residual cytoplasm will produce reactive oxygen species, and these spermatozoa particularly will be susceptible to DNA damage and injury. The spermatozoa that do not produce ROS are likely to be protected. So what is the role of antioxidant in the context of in vitro settings? How do these antioxidants work specifically in protecting spermatozoa from exogenous ROS? So there are a number of studies that have suggested or have shown that if you incubate spermatozoa with an oxidative stress, superoxide anion or hydrogen peroxide, and then add an antioxidant, you can protect spermatozoa from the oxidative stress. So exogenous ROS would benefit from antioxidant supplementation. What about semen processing? So a number of studies have looked at the role of antioxidants in semen processing on sperm motility, sperm DNA integrity, and here the data are somewhat mixed. So when you incubate spermatozoa with antioxidant with a gentle semen processing procedure or incubation, some studies support the use of antioxidants, others do not. So antioxidants in vitro are of modest value in protecting sperm, at least normal sperm, from oxidative damage during semen processing. We recently showed, again along these lines, using an animal model, that if you take sperm from a normal wild-type animal and incubate the sperm over time, whether or not you use an antioxidant does not afford protection. However, if you take abnormal sperm from, in this case, FSH receptor knockout mice, when you incubate the sperm without an antioxidant, you will see some damage. If you add an antioxidant, here we're using catalase, you will protect sperm from oxidative stress. So antioxidants may help protect abnormal sperm from oxidative stress during semen processing. What about cryopreservation? A number of studies have looked at the role of antioxidant therapy on the potential adverse effect of cryopreservation on motility and DNA integrity. Most studies have shown that if you incubate spermatozoa with an antioxidant prior to cryopreservation, you will improve post-thaw motility and DNA integrity. So antioxidants are protective in this respect. So in summary, what we can say is that dietary antioxidants and nutritional supplements will improve sperm parameters and pregnancy rates. The favorite antioxidants in this respect are vitamin C, E, selenium, zinc, folate, L-carnitine, coenzyme Q10. However, we need to keep in mind that the evidence is based on small, randomized controlled studies.
It's okay.
Can I go back?
Yeah.
Randomized controlled styles. Okay. Tell me when I can... So in summary, what we can say is that dietary antioxidants and nutritional supplements can improve sperm parameters and pregnancy rates. And the antioxidants that have been used in most of these studies include vitamin C, E, selenium, zinc, folic acid, L-carnitine, and coenzyme Q10. However, it's important to keep in mind that the evidence is based on small randomized controlled trials, approximately 25 studies in total, and the mechanism of action and ideal regimen have not been established. Antioxidants in vitro can protect sperm from exogenous reactive oxygen species. They can protect immature sperm from gentle semen processing, and they can protect sperm from the damage due to freeze-thawing. But antioxidants do not protect normal sperm from very gentle semen processing. Thank you again for your attention. I hope you've enjoyed this talk. Okay, I'll just shift it a little.
Yeah. I want you to do that again.
Okay.
Chuckled.
Okay, you don't want
right?
for the first time I
Yeah.
chuckled.
Yeah, he chuckled.
Thank you.
Yeah,
Okay.
when he said thank you, he kind of went.
Actually, I finished the slide, so you just want me to say the last thing?
Well, I guess my question to you is.
Yes,
and
how
it's
did
a
you want me
level-
to-
And it's a level of comfort.
Yeah.
Are you comfortable saying, okay, so you've summarized and you've created a grocery list of different
Right,
antioxidants are available.
Yeah.
The question I have for you, are you comfortable saying, okay, here's the grocery list. Yes, the studies are small. There are valid products available.
Right.
I recommend, don't want to say a recommendation. The position, the clinical position right now is that they're safe to use. There appears to be a benefit and there's
Right.
no harm to the patient outcome.
Okay.
That's to me, if that's what you would say to your patients.
Right. Okay, sure.
So you're just sort of tying it up with a bow.
Yeah.
When you're ready. You might want to start
Okay.
with the whole slide.
I'll start with the whole slide, sure.
Yeah.
So, you're okay?
We're good.
So to summarize, what we can say is that dietary antioxidants and nutritional supplements can improve sperm parameters and pregnancy rates, and a number of antioxidants have been shown to do this. However, the evidence we have is based on approximately 25 or so small randomized controlled trials, and the mechanism of action and ideal regimen are not established. Antioxidants in vitro can protect sperm from exogenous reactive oxygen species. They can protect immature sperm from gentle semen processing, and they can also protect sperm from damage due to freeze-thawing. But they do not protect normal spermatozoa from gentle semen processing. So what we can take from this is that there is a sound, rational approach to using antioxidants for the treatment of male infertility. These antioxidants are safe to use with few side effects, and there's some now controlled trial evidence that these antioxidants will be beneficial both as dietary antioxidants and as antioxidants to be used in vitro. Thank you.